Listen Up Audio presents Katrina, Mississippi. Voices from Ground Zero. Written by NancyKay Wessman. Narrated by Kevin Stillwell and Gwen Hughes. Author's Introduction. When what would become Hurricane Katrina emerged suddenly over the Bahamas, intensified into a tropical storm, headed west to Florida, grew stronger over the hot Gulf of Mexico, and then hammered the Mississippi Gulf Coast, I watched and worried. For the first time in a quarter century, I was not responsible for preparedness or response communications. I was retired from state service, no longer responsible for getting the word out before the storm and communicating important public health messages afterwards. I had to remind myself, this hurricane was not my job. Working as communications director for the Mississippi State Department of Health from 1979 to 2003, I was duty-bound to warn people about the danger hurricanes bring, the harm they can inflict, the debris and hazards they leave behind. What should individuals do to get ready? Should they move to a place beyond the storm's direct path? How could they deal with lost water pressure, thawed food, cuts and scrapes? Where could they get emergency medical care? My job required that I answer those questions, and on the response team, I helped return the community to better, safer, healthier, through assuring people had access to information and connections to disaster recovery assistance. Before the turn of the century, before broadly available access to computers and the internet, before smartphones and social media, we relied on communication tools and channels that today seem archaic. In the 1990s and early years of the 21st century, we relied on relationships with the mass media, on cooperation among all members of the public health team at every level, on the trust between government agencies and the citizens of Mississippi. Working with the Centers for Disease Control and Prevention and the National Public Health Information Coalition, for example, Mississippi's Public Health Public Relations team developed and hand-delivered to newspapers, as well as radio and television stations, a printed manual for disaster preparedness. Before hurricane season that year, we designed and gave the mass media a how-to guide for communicating from the public health perspective about hurricanes, ice storms, floods, infectious disease outbreaks. The guidelines, also given to strategic managers within the public health agency, contained situation templates for communicating objectives of that time, to strive for preparedness for bioterrorism, emerging infectious diseases, and other public health emergencies, such as hurricanes, tornadoes, and winter storms. Objectives reflected national and local concerns. Crisis response plans, procedures, and tools highlighted our changed worlds of practice after the Oklahoma City bombing of 1995 and the terrorist attacks of September 11, 2001. Those disasters cemented the critical importance of communication as an evidence-based public health intervention that must be considered before, during, and after an emergency. The responsibility to inform, educate, and empower people about public health issues holds a solid third place in American Public Health Association's list of 10 essential public health services. After the terrorist attacks, the United States developed a national preparedness system with a best practices-based national response plan for recognizing potential or real threats and for managing disasters. The National Interagency Incident Management System, NIMS, an outgrowth of California wildfire fighting tactics from the 1970s, would become the standard for all levels of government, non-governmental organizations, and the private sector to work seamlessly to prevent, protect against, respond to, recover from, and mitigate the effects
Sample complete. Ready to continue?